Good afternoon, all. Welcome. You are listening to another special episode of Respire, a lung cancer series podcast. A podcast series which is navigating the journey of lung health and oncology. Lung cancer is all you all know. Lung cancer is the most common and remains one of the leading causes for cancer-related deaths in India. There is a lot of misconceptions, myths, and gaps in understanding lung cancer. So it always falls under the shadows of focus and expertise. So today we have as a renowned medical oncologist who is expertise into this Dr. Manivannan, consultant medical oncologist from Dr. Mani's Oncobest Cancer Center, Coimbatore, to throw some light on the vital aspects of lung cancer awareness. And welcome, Doctor. It's always been pleasure to invite you on this platform.
Yes, sir. Welcome.
Awareness program on lung cancer.
Yeah, thank you.
Okay. So, getting into the topic, sir, to understand the burden, we'll come to the understanding the burden. So why is lung cancer becoming more common among non-smokers also?
So nowadays, not only lung cancer, each cancer gradually increasing the incidence. So because of the so many factors, lifestyle changes, food habit, obesity, stressful life. So everything cause for the on the whole cancer, not only lung cancer, but even though so many cancers, even though breast cancer is the leading cancer in the worldwide, not only India, Coimbatore, Hyderabad, breast cancer is the leading cancer, but cancer-related mortality is more common in lung cancer. So the main reason is, so we are detecting cancer in the advanced stage.
Okay. So do you say it is common in non-smokers also, sir? Very common, sir?
Definite. So very common in smoker. Almost 90 to 95% of the lung cancer will affect smokers. 5 to 10% of the people, even smoker also, they are having the lung cancer. That for that, second-hand smoking, air pollution, factory contamination, even unhealthy food habit. So even nowadays we are eating vegetable and fruits. No, this has a lot of pesticides. So we have to regularize everything to control cancers.
Okay. So what are the major risk factors for lung cancer in India beyond tobaccos? Apart from, you already explained pollution and passive smoking. Any other risk factors, sir, apart from this?
The lifestyle, sir. Lifestyle changes, obesity, unhealthy food habit. These are all other risk factors.
Okay. And coming to the diagnosis part of, if we talk about early detection is so crucial, sir, in lung cancer?
Yeah, definitely. Like other cancer, lung cancer also, for every cancer, we have to detect yearly. If we detect yearly, the chance of cure is high. The only thing, so this is common in smoker. Yeah, all the smoker, they have chronic bronchitis. That is one clinical conditions. This will cause cough, sometimes blood in the sputum, chest pain. So even lung cancer will cause the same symptoms. Usually the smoker, what they will feel, so because of the smoking, I am having these symptoms. Like that, they will ignore the alarming symptoms. And so in our India, we are detecting lung cancer in stage 4, almost 90 to 95% of the situation. In smoker, if they have any alarming symptoms like blood in the sputum, cough, voice changes, loss of weight, appetite, definitely we should not ignore. Just we have to go through for investigation, the simple X-ray or CT.
Okay. And this
will detect the
diagnostic...
cancer. This will detect cancer in the early stage, stage 1, stage 2.
Okay. And sir, this diagnostics tools are accessible, sir, because a lot of people will be coming from tier 2, tier 3 cities to you. So these are like low dose CT scans, as you mentioned. They're
Definitely.
affordable, sir. as a
Yeah, nowadays tier 2, tier 3 cities everywhere CT is common available. So over 1 decade back, no. So CT will be available only in metro cities. Nowadays, even tier 3, even small villages also they are having a hospital. They are having CT scan. Those who are all comes under high risk, definitely that general practitioner as well as even pulmonologist, they have to advise for low dose CT. If they will advise, definitely the diagnosis of lung cancer in early stage, okay, so we can detect lung cancer in the early stage. If we detect lung cancer in the early stage, the chance of cure will be high. So the burden, the treatment burden and the side effect of the treatment, everything will be favors for the patient.
Okay. And what are the symptoms should patient never ignore, sir? What kind of
Yeah,
symptoms?
already told you know. So chronic cough, blood in
Okay.
the sputum, voice changes, weight loss, chest pain, loss of appetite, so swelling in the neck. These are all the alarming symptoms of lung cancers.
Okay.
They should not ignore these symptoms.
And coming to the part of treatment and innovation, sir, how has this treatment landscape been evolved in lung cancer if you compare with the last decade?
So previously we are not having that much treatment options. Okay, so only surgery, even basic chemotherapy. So nowadays, even every aspect, not only in surgical aspect, so radiotherapy, chemotherapy, so every aspect nowadays we are having so many advanced treatment. Okay, coming to the surgery, so we can remove that involved part alone in surgery. Like that precision of surgery is improved a lot compared to previous decades. So coming to radiotherapy, nowadays we are having SRS, LINAC. So in that situation, we can focus tumor alone. We can treat tumor alone. We can spare the normal tissue. The side effect of the treatment will be low. So even LINAC, this advanced radiotherapy machine available even tier 2 city also. In chemotherapy, so previously we used to give chemotherapy, but nowadays we have so many targeted molecules. So targeted molecule, immunotherapy, on the whole, previously we took only biopsy. Based on the biopsy, we used to treat. Nowadays, we used to do molecular testing. Molecular testing means is there any cancer mutation, cancer signal positive, or any hereditary gene mutation? We can target those signals. So it will target, it will bind to that corresponding site. So it won't cause much side effect.
Okay.
It won't cause much side effect. The treatment, I mean, outcome also will be, extraordinary. The treatment outcome and very high.
Okay, sir. And you already told that targeting the genes, particular genes, would be the targeting therapy. And what about this immunotherapy, sir? And how is it is helping lung cancer also? Can you throw some light on immunotherapy, sir?
Yeah, definitely. So immunotherapy is the main modality of treatment nowadays. Not only lung cancer, all over the body, we can use immunotherapy if the MSI or PDL1 is, if MSI
Oh,
is high or the PDL1 is positive, we can use immunotherapy. So irrespective of the molecular type, if the PDL1 is more than 50%, okay, we can use immunotherapy alone without chemotherapy. So what the immunotherapy will do, it will convert or it will increase our immune system to fight against cancer. It will direct our immune system to fight against cancer. So the only thing previously this immunotherapy cost will be high. Nowadays, so many companies like your company, they are reduced the rate. So this will be easily available for the patient at affordable cost. And also we have so many patient support program now. So if we
yes.
enroll the patient in patient support program, the company will sponsor some amount of the drug. So the patient will be benefited.
Okay, sir. Sir, how does you personalize the treatment plans for different types of lung cancer, sir, based upon stages or?
Yeah, first if the any patient have, if they have symptoms, First, we have to go through clinical examination and imaging. So, clinical examination followed by imaging. In imaging, we have high suspicion of lung cancer. Then we have to plan for biopsy. In the biopsy, simply we will categorize the what type of tissue, like adenocarcinoma or small cell carcinoma or squamous cell carcinoma. First, we have to confirm the tissue. Then we will plan for molecular testing. So previously we used to do separate platform, IHC, then FISH and RT-PCR. Nowadays, that single test will detect all cancer gene mutation, that is NGS, next generation sequencing. The single platform of test will diagnose, will pick up all molecular alteration mutations. So based on that, we have to treat.
And when we talk about accessibility and affordability, sir, because when we India is the most, for example, whenever
It's a
we go for
developing
therapies
country.
or yeah,
It's a developing country. In Western countries, the insurance support will be there, but in our India, it's not like that. But even previously, this NGS test and all, it will cost 2 lakh, 3 lakh like that. Nowadays, even 15,000 rupees, they are completely doing all the markers in lung cancer. This is definitely so good option for a patient.
okay. And what are the major barriers you generally see in quality cancer care, sir, in India for lung
So
cancer?
on the whole, country like India, so much myths in society. If they detect cancer, so many people they will advise for native treatment. They have fear of radiotherapy. In India, we used to tell that word current treatment. For radiotherapy, we used to in Tamil we used to tell கதிர்வீச்சுன்னு தமிழ்ல கதிர்வீச்சு நம்ம வந்து கரண்ட் அப்படின்னு சொல்லுவோம். அவங்களுக்கு புரியறதுக்காக கரண்ட்னு சொல்லுவோம். They will think that a power line, no. So like that, this has much side effect. So we have to change the word itself. Laser treatment or radiotherapy, like that we have to use. We should not use current treatment. That itself create or anxiety to the patient. So on the whole, we have to create awareness to the society regarding this smoking health hazards. First, we have to create awareness in the school level, college level, next society level. Those who are all comes under high risk, first we have to initiate for free low dose CT. I don't think this is how much possible, but anyway, at least we have to encourage them for free low dose CT. Then those who are all diagnosed with cancer, first we have to create awareness. These are all simple tests nowadays available, so many advanced treatment. These are all not having that much side effect. So only thing, so they have much fear regarding cancer treatment. And also nowadays the treatment cost, it's gradually coming down. Even the middle class people, they can easily afford. Even poor people, they can reach the government hospital in state like Tamil Nadu. We are having so many medical college, so many tertiary cancer center. So in each tertiary care cancer center, we are having advanced LINAC machines, radiation oncologists, medical oncologists, surgical oncologists. Only thing, we have to create awareness in the school level, college level, society level.
Okay, a lot of awareness is required, rightly said, sir.
Yeah, definitely.
And you already explained about the things are changing and a lot of development is happening on cost of therapy and also diagnostic thing. But still, what advice you give to the patient who is coming from a small town or a village for the navigation of the treatment, sir? What advice you generally give?
So almost or 60% of the Indian cancer patient, they are not taking proper treatment. They are thinking that this allopathy medicines, this is costlier, not easily approachable. Like that, they are thinking. But nowadays, even tier 2 cities, even tier 3 cities, oncologists are practicing. Only thing, after the diagnosis, they have to consult specialist. They only know how to proceed further, what is best treatment options, where they can get everything. They will have ideas. If they are affordable, they can treat in private hospital, or even they can go for government hospitals. So many government hospitals, they are treating patient in free of cost.
Okay. Anyway, sir, cancer word itself is very, mean to say, it is not only affecting the individual but also entire family members. So, when we talk about psychosocial impact, how important is mental health support in cancer recovery, sir?
So for that, we have to encourage already treated a patient. There so many, I mean, so many patients, lakhs and lakhs of people cured from cancer. No, we have to encourage them to speak in the society. So they have to tell. So how they have faced the things, what they feeling of treatment, side effect. On the whole, cured patient, they have positive vibes, no. So they have to speak in the society. That only thing, country like our India, they hide everything. We have to encourage cured patient to talk about the cancer treatment. If patient itself
Okay.
telling about the treatment, then the newly diagnosed patient will accept the treatment.
And what role does caregivers play in this overall treatment journey, sir?
So for treatment aspect, doctor, patient, and patient attendant, there are important three pillars. If all pillar is very strong, definitely the treatment will be success. So it's
Okay.
everything has equal important. Doctor have to give best treatment. The patient's attendant to support the patient. The patient have to obey the doctor as well as attendant words.
Okay. And sir, coming to major misconceptions, based upon your experience, what are the most common misconceptions or myths you heard from your patients about lung cancer?
So cancer will spread one person to another person. If you eat carbohydrate food, it will increase the cancer size. If cancer comes in one family now, all the people will get cancer. So caregiver has a risk of getting cancer. Cancer is not curable. Okay. So
Okay.
even if we detect clearly, they will think cancer is not curable. If cancer diagnosed, next they will think of the death.
Okay.
Cancer treatment
And
is
sir,
high cost.
okay, cost everything. So many misconceptions you have heard, sir. Thank you. And what practical advice would you offer someone at higher risk who is reluctant to for the treat, who is reluctant for the treatment, and what kind of advice you show mean to say to those who are in higher risk and who are reluctant to treatment, sir?
High risk individual or cancer patient you are telling?
Cancer
Smoker or
patient, sir. Any kind of cancer patient who is at higher risk and is showing reluctant to the treatment.
oh,
What practical
for that
advice?
only we have to counsel the patients. So in Western countries, what they will do after the diagnosis, next step they will counsel the patients. So
Okay.
here we are not counseling the patient properly. So after the
Okay.
diagnosis, next important step, counseling of the patient. We have to counsel in such a way they have so many options. See, in real life they have so many options. We have to counsel the patients, and also so many options like private hospital to government general hospital or trust hospital. They have so many options. Only thing they have to take treatment in oncologists with oncologists.
Okay. Okay. And
Already I
if you
told you
could
no.
share, yeah.
Already I told you no. So even general practitioner or pulmonologist, they have to advise low dose CT screening for all eligible individuals. Definitely all smoker, they will go to consult in general physician or pulmonologist for some other chronic bronchitis or pneumonia or cough. For the yearly symptoms, they will consult. No, that time they have to insist for tobacco, smoking, hazards of smoking. They have to advise for quit the smoking and as well as low dose CT.
Okay. And sir, if you could share one powerful message for our audience, because general audience are also there in this live session, one powerful message about lung cancers.
Don't smoke. It not only harm you, it will harm your family, your society, your country. On the whole, you should not smoke. Stop smoking now itself. If you have any help, you can consult a nearby doctor. Still, you are not able to quit the smoking. If you are a high-risk individual, please visit nearby oncologist for low-dose CT. If you detect lung cancer in early stage, 100% curable. You should not miss the chance.
Okay. So, thanks for sir. Thanks for your valuable time and sharing your expertise and knowledge on this lung cancer, and also sharing a lot of things on awareness, how to treat the patient, the diagnosis part, screening, everything you have explained to us, sir, to the audience. Thank you very much, sir. Have a good day, sir. Thank you very much.
Okay, thank you so much. We all
Thank you.
together unite to fight against cancer. Okay, thank you so much.
Thank you, sir. Thank you.